Hello, my name is Professor Timothy Devos. I'm a haematologist at the University Hospitals of Leuven in Belgium. I'm really happy to join you today. Palliative care and assisted dying, by which I mean assisted suicide and euthanasia, do not go together. This is clear from the definition of palliative care, which says, palliative care neither hastens nor postpones death. Palliative care has all the means to avoid suffering and pain for a person at the end of his or her life, and to accompany the patient with maximum attention given to the physical, psychological, social, and spiritual aspects of the person in a holistic way. From our experience of 2 decades of euthanasia in Belgium, we can see now that there are several other reasons to believe this practice does not go hand in hand with palliative care. In Belgium, the laws on palliative care and euthanasia were voted through at the same time in 2002. Since then, all media attention has gone to euthanasia cases, and palliative care has failed to receive either comparable public attention or sufficient and promised financial support. As a consequence, when reflecting about the end of life, my patients have only 2 ideas in mind. Either they will suffer or they will ask euthanasia. It's a horribly grim choice, and it shows an enormous ignorance about palliative care and its benefits. For me, this situation is a good occasion, a good opportunity to propose them palliative care as the third way, and explain them the tremendous possibilities of palliative care nowadays. That palliative care can provide the good, serene, and natural death that so many patients overwhelmingly desire. It is sometimes disheartening that palliative care needs to be explained to patients over and over again when they all know about euthanasia. That's not normal. That's not the way it should go. It should be the other way around. In 2002, when the law was voted through, euthanasia was presented as a rare exception of the legal prohibition of killing, permissible only in rare cases of extreme, uncontrollable suffering in terminal patients, for example, in those suffering of asphyxia, those with extreme pains, or those with pre-terminal anxiety, and also made at the request of an adult with mental capacity. Now, almost 20 years later, euthanasia is increasingly applied to take the lives of non-terminal patients, like psychiatric patients or older patients with the so-called polypathology, a combination of different non-terminal diseases and conditions in the elderly. Sometimes euthanasia is proposed by healthcare workers to patients directly as recommended solution to their suffering, as we show in the book Euthanasia, Searching for the Whole Story. It has become considered as the good way of dying. We as a society went from tolerating euthanasia to normalizing it and conferring upon a moral acceptance. And we have now reached the situation where euthanasia has become a banal and everyday fact of life. The number of deaths by euthanasia has increased incrementally each year as the practice of euthanasia shifted from the initial idea of an exceptional procedure for exceptional situations to the absolute right of the patients to end life when life is considered not to have sense anymore. Yet, palliative care is the opposite. It is the opposite of this. Palliative medicine is about doing everything to give a sense of meaning and purpose to the last days of life, to stimulate care and solidarity. Tragically, it has become extremely difficult to give good palliative care while a patient has the euthanasia paperwork ready in the nightstand and asks for euthanasia on a difficult day, requesting another doctor if their request is not immediately granted. You can read the story of Corinne in the book Euthanasia, Searching for the Whole Story, to understand what it is like. The doctor and the whole palliative care team are then transformed into an instrument of the patient's desire, amputated of their vocation to care and to heal, and treated like furniture. I do not believe in the so-called integrated palliative model, a model where palliative care and euthanasia go hand in hand. The evidence suggests the opposite to be true. In palliative care, the patient and the doctor share a commitment, an alliance. Doctor and patient accept that they have a real responsibility towards each other. The ultimate aim is clear. In the end, a death with authentic dignity, respecting the ethical framework of both patient and doctor. The way to get there is intrinsically different between palliative care, which is about guiding the patient through the natural process of dying, and euthanasia, which is intentionally inducing death on the patient demand. With euthanasia, the patient-doctor relationship becomes a contract, and the doctor is turned into an instrument of delivering death. To quote the president of Palliative Care Federation, more and more pressure is put on healthcare workers and doctors because euthanasia is claimed as an absolute right. Looking together for reasonable alternatives to relieve pain, in a serene discussion together, the patient, his family, and the doctor becomes more difficult. Another evolution which shows that palliative care and euthanasia do not go together is this. Initially it was thought that euthanasia would only be accepted after applying the so-called palliative filter, which means that first, all the possibilities of palliative care should be proposed and discussed with the patient requesting euthanasia. Now, almost 20 years later, applying the palliative filter is attacked. It is attacked as a barrier impeding the patient to receive the euthanasia he wants. Now it is said, by proposing palliative care, doctors obstruct patients who want euthanasia. It is even illegal because trying to convince a patient about a certain management is against the law on patient rights. That's where we are. The palliative filter sounded like a nice theoretical concept when the law was developed. Now, almost 20 years later, we see it does not work at all. As euthanasia becomes normal, the right of conscience of doctors and health workers is increasingly under pressure. As euthanasia is considered as the good way of dying, why should a doctor refuse? Is he heartless? Without any empathy? The pressure of the family on doctors to administer euthanasia is heavy. Nobody cares about mental and emotional charge on doctors performing euthanasia. how it changes them, and how they try to cope with it. A citation from the book Euthanasia, Searching for the Full Story. I had the pleasure to coordinate this book together with several experts from Belgium. In this book, a nurse writes, "I have been witness of the deep distress that doctors experience when they perform euthanasia, such as one experienced and qualified doctor. His eyes filled with tears as he confessed that some nights he wakes up in sweat, seeing the faces of the very people he has euthanized in front of him." Be aware that once the door of assisted suicide euthanasia opens, it will always open more. That's the way it has gone in Belgium and in all the countries without exception where euthanasia has been legalized. You would be deluding yourself if you imagined that it would be any different in the UK.